My name is Dr. Susan Silveira and I work at NextSense in Sydney, Australia. I have a dual role. I'm a researcher and I'm also in an academic position, and I work closely with Macquarie University. I knew before I left school that I was really interested in eyes and vision. I'm not quite sure why, but that was my passion. So I went through university in Sydney and I became an orthoptist, which is an allied health therapist. And I worked mainly in paediatrics. I was lucky enough to work in some of the major paediatric hospitals in Sydney, working closely with children and their families. And it was in a diagnostic and a therapeutic role. I also held a position at the School of Orthoptics at the University of Sydney for quite a few years, so I was teaching in that role, and I was lucky enough to be approached by NextSense 15 years ago to join their academic staff. At the time we were teaching a program through the University of Newcastle in New South Wales, Australia, and now that program is taught through Macquarie University. I did a Master's in Clinical Health Sciences along the way, and I completed my PhD in Childhood Vision Impairment in 2018. The Australian Childhood Vision Impairment Register, or the Register as we like to refer to it, was first set up in 2008, and it was a project that was sponsored by NextSense and has continued to be sponsored by NextSense to this day. It's a project that was begun because we didn't know how many children lived in Australia with vision impairment. And that's really important information, and I'm often asked, how many kids do we have? And I guess sadly, in some ways, I can report some information, but I'm still a little bit restricted in other ways because we haven't captured every single child on our project yet. The register's been going for quite a few years now, and I might share some reflections with you that you might find helpful and hopefully motivating as well if you do work with families, or you do have the opportunity for projects like this that gather health data. We gather lots of health data in Australia, and other countries do the same thing. What we don't do well is that data doesn't talk well to one another. We don't share data, and there's lots of reasons for that. There's privacy, confidentiality, all sorts of reasons why we don't. But it is so very important that we are able to access data. We can talk in an informed way, and one benefit for NextSense in having this data is that we have been able to tailor services. We've been able to say, where do these children live? What services do they need? What are the specific services they'll require according to the complexity of their eye condition and their other comorbidities? So it has had a positive impact on our service. It's also allowed us to really connect with our families and understand their experience. One of the questions that we ask is, well, it's not really a question, we just say, tell us about your child. This isn't all clinical data that we gather. We love to hear what the families tell us, and despite the clinical findings and the diagnosis and the journey that they've been on, families can be so very positive about their children and tell their children's story with pride and hope. And it's a really important part of having that person-centred approach to our healthcare and understanding that. So being able to gather data like this is super important, but as I mentioned at the start, we rely on the goodwill of people like yourselves to tell people about these projects and keep telling them and keep encouraging them. And we also rely on you to return data forms and be part of projects. So it really is a big collaboration that takes a lot of effort. Everybody's busy, everybody's time poor, and without that input from everybody, it's very difficult to gather that data. But we now can talk in an informed way, which we couldn't before 2008. We can advocate for these children, we can advocate for their families. We can talk to government at times like when the National Disability Insurance Scheme was being created and formulated. and other disability support schemes that Australia has had, we've been able to say, hey, there's a group of kids, they need support. We know with support they'll do really well, so please include them. And it's very hard for government to deny that support when we have data. I'm really lucky to be involved in several other research projects, all of them contributing to what we know about vision impairment, particularly in children, and the impact on children and their families. And they're all trying to improve the outcome. That's a shared goal that all these projects have. So the second project that I'm involved in is with a large research group, and we were really lucky to be given an Australian Research Council award and grant in 2023. And there's a group of us working in this research team. So there's myself, a colleague who's a special educator. We have colleagues who specialise in vision impairment, things like understanding orientation and mobility needs, also in education. We also have an architect, a designer, and another group of professionals who specialise in tactile graphics and assistive technology. So we've come together as a like-minded research group, and the aim of the project is to try and develop, so design from scratch or retrofit playgrounds so that they are fully accessible for children with vision impairment. And we've done a bit of work on this project so far, so we're at preliminary stages, but we are surveying users. So we've talked to parents of children with vision impairment and asked what their experience is like supervising their child with vision impairment in a playground. We've also talked to the professionals that help supervise children with vision impairment in a playground. Type of people like teachers, orientation and mobility specialists, other allied health, because playgrounds are great places to do natural assessments of children with their development and their interests. So we're getting lots of feedback from those groups, and we're finding some quite interesting things that we're going to have to build into this research project as we move along. We're also really interested in the environment that playgrounds are built in, because we know things like glare are a big problem for children with vision impairment, so we're looking at how do we minimise glare. We're looking at particular setups that will suit children's orientation and mobility needs, and we're even focusing on things like surfaces, because tactile information is very important when you have vision impairment. A third project that I'm working on at the moment, and this is really in its infancy, but we're working with families to try and understand better the impact on a family of raising a child with vision impairment. And that's super important, because we should focus on the child, but it's also the ecosystem around the child that needs lots of support. And often families feel isolated, and they don't feel that anyone is really interested in their situation and how having a child with a disability impacts on many aspects of their life. So we're hoping to be able to talk a lot to families, hear their stories, and start reporting on that. NextSense is the organisation that funds the research that I'm currently involved in. So NextSense is a service provider for people who are deaf, hard of hearing, or are blind or have low vision. And it's a very large organisation, and I work in the professional education and research arm of NextSense. It's called the NextSense Institute. My passion is around children. There's no question about that. And as my career has advanced, I've become very interested in families, quality of life, and the impact on families raising a child with vision impairment. I want to be able to do everything we possibly can to give not only the child but their family a really fulfilling life that gives them access to every aspect of life despite the fact that they have a vision impairment. My main passion is my own family. I have a large family, mixed race family, and we have people right through all the age spectrums. I like to spend as much time with them as I possibly can. I'm also a bit of an amateur artist. I really like drawing Australian animals, particularly birds, and I'm pretty passionate about our environment, the beautiful country that we live in, but also about the impact of climate change and the lack of action and concerns that I have for future generations. So I hope the young people in my family will be able to enjoy the beautiful country that we live in. So I try and keep an eye on any sort of environmental initiatives that I can easily be part of, and hopefully lessen my footprint on this planet.